Good afternoon, Miss Moyer. May I come in?
Yeah.
Thank you. I enter and I perform hand hygiene. Once again, good afternoon, Miss Moyer. My name's Kevin. I'm a nurse here to take care of you. Could you please verify your first and last name and your date of birth for me?
Yeah, Caitlin Moyer, November 28th, 2002.
Perfect. Thank you, Miss Moyer. If it's okay with you, I'd like to perform a head, eyes, ears, nose, and throat assessment on you. This will consist of two parts. First, I just have a few questions I'd like to ask you about those parts of your body, and then I'll move into an actual physical assessment. All in all, this should take about 15 minutes, hopefully less. Do you have any questions before we begin? Any concerns? Okay, perfect. Like I said, I'm going to go ahead and move right into my questionnaire first. Do you have any history of headaches or head injuries?
No.
No? Any neck pain or limitation of motion in your neck?
Mm-mm.
No? Any history of head or neck surgery?
No.
No? All right. Moving on to your vision. Do you have any vision difficulty at all or any vision pain?
Mm-mm.
No? Do you experience any redness or swelling?
Sometimes if I'm having like some allergy issues,
Okay.
just like seasonal allergies, like to oak trees,
Okay,
stuff
to oak
like
trees. Okay. Would you say as well, so you said you experience redness and swelling sometimes when in contact with oak trees.
Mm-hmm.
Do you experience any watering or discharge as well from your eyes?
Sometimes.
Sometimes.
I mean, not every time, but
Okay.
Yeah.
I understand. Any history of vision problems at all for you? No? And I see you don't have glasses on. Do you have contact lenses on or you don't use them? Okay. Moving on to your ear, do you experience any ear infections or have you experienced ear infections in the past?
yeah. Sometimes it's in relation to my allergies.
Right.
Because sometimes my allergies will lead to sinus infection,
Okay.
which will lead to ear infection.
Right. Okay.
So,
And then moving along, do you experience any ringing in your ears or vertigo? No. And then moving on, do you experience any frequent colds?
mm-mm.
No. And then, so with your allergy to oak trees, with your sinus infection, do you experience sinus pain at all with it?
Yeah.
Okay, gotcha. And then, do you experience any sore throat because of the discharge?
Yeah, if I get a lot of like draining, then
Right.
yeah.
Okay, gotcha. And then, last question, do you smoke or consume alcohol? All right, and that's it for my questionnaire. I'm gonna go ahead and move straight into the physical assessment. So first, I'm gonna look at your head, and I'm seeing it's round, it's symmetric, and it's proportioned properly to the rest of your body. It's an appropriate size. Looking, it's central on the midline, and so I'm gonna go ahead and inspect your skin. Skin is smooth. Checking your scalp as well, smooth, no tenderness on here, no tenderness on your skin either, no lumps anywhere. And then checking your facial structures, no abnormal sizes in your facial structures, they seem symmetrical. I'm not seeing any involuntary movements. And then I'm gonna go ahead and test just your voluntary movement. Could you smile for me? Okay, perfect. Symmetrical voluntary movement on both sides. And now I'm going to go ahead and move into the eye portion. So first, I'm going to do a vision test.
Mm-hmm.
So what I have with me, it's called a Rosenbaum chart. This just tests your near vision. So what I'm going to do is I'm going to hold this up to your eye level, a bit closer to you. What I'd like you to do is, if you just let me know, I'm going to have you read the line with the smallest letters,
Mm-hmm.
or whatever line you're comfortable with. You just let me know the number of the line. I've numbered them here for you. And then once you let me know, you just read across until you see this blue line that I've indicated, okay?
Okay.
And so we're going to test it one ear at a time. So first I'll have you cover your left ear, your eye.
Mm-hmm.
I'll have you cover your left eye first, and then we'll test your right eye, okay? And then which line are you going to read?
9.
9, okay?
937826 WMEXOO.
Perfect. All right. So that's 20 and 25 vision in your right eye, and then go ahead and cover your right eye. We'll test your left eye. And again, just let me know what line you're going to read.
Line 9.
Okay.
937826 WMEXOO.
Okay, 20/25 vision in your left eye as well. So we're gonna go ahead and move on. So that's it for the vision test. I'm gonna go ahead and check your eyes themselves now. I'm looking at your eyebrows, I'm looking at your eyelashes, and I'm looking at your eyelids. Everything's present bilaterally, everything's symmetrical. There's no scaling or lesions present anywhere. There's no discharge coming from your eyelids, which is good. And then I'm gonna check your conjunctiva. So I'm just gonna go ahead and put my thumbs kind of on this area here.
Mm-hmm.
I'm just gonna check underneath. So I'm seeing pink on the lower lids, which is good. There's no drainage, no lesions present. And so now I'm gonna test your corneal light reflex. So I'm gonna shine this light in one of your eyes, and I'm just gonna see if I can see that light pop up in the other eye as well, okay? Let me know when you're ready.
Okay.
Perfect. And let me test the other eye. Let me know when you're ready if you need a second.
Okay.
You're good? Perfect. The light reflex was symmetrical. And looking at your sclera is nice and moist. It's a china white color. Looking at your cornea is smooth, it's transparent, it's not opaque in any way. Looking at each of your irises, both irises are round and regular, and the blue color is evenly distributed on both irises. Moving along to your pupils, first I'm going to assess their size. I just have a chart here on my little pen. I'm just going to see the average size first. Normally we like to see between 3 to 5 millimeters at rest. So 5 millimeters there on the left eye, and 5 millimeters on the right eye, which is good. Like I said, that's within the normal range. I'm going to go ahead and test their reaction to light. So I'm going to see if both of them constrict when I shine it in one eye, and then I'll test the other, okay? Let me know when you're ready.
Okay.
Perfect. And then let me know when you're ready again. Okay. Both pupils constricted when I show them the light. Are you okay?
Yeah, I'm fine.
Okay. So, and now we're gonna move into the accommodation test. So I'm gonna hold my pen light. I'm not gonna shine it at you this time.
Thank you.
I'm gonna hold it out here, and I'm just gonna have you track it as I move it closer to you.
Mm-hmm.
And then I'm gonna move it back towards me. I'm gonna assess your eye movement, and then I'm gonna assess your pupils and see how they adjust, okay?
Mm-hmm.
Eyes closing in on the object, pupils constricting as it grows closer, moving back, eyes moving outward, which is expected, and the pupils are dilating. And so now I'm going to go ahead and assess your peripheral vision.
Mm-hmm.
And so I'll have you're going to cover your left eye first, and I'll cover mine on the same side.
Mm-hmm.
So I'm going to stick my hand out here. And once I say start, because I'll start moving it in closer, you just let me know immediately when you see my hand, okay? Then you just let me know if you keep seeing it, okay?
Okay.
All right. Starting now.
I can see it.
Okay.
Still see it. Still see it.
Okay. Now we'll go ahead and check on the other side now. So cover your other side. Perfect. And are you ready?
Mm-hmm.
Okay.
I can see it.
Okay.
Still see it. Still see it.
Perfect. And the last part of the eye exam, I'm going to test your cardinal fields of gaze. So I'm just going to have this tip of my pen light, not going to shine it at you.
Thank you.
All I'm going to have you do is just track its movement with your eyes, okay?
Mm-hmm.
Let me know when you're ready. Perfect. Excellent. All right, that's it for the eye portion of the exam. We're going to move on to the ears. So I've been assessing your hearing during our conversation. It doesn't seem like you have any issues. You've been responding in a timely manner to anything that I've been saying, any questions that I've been asking. We've been holding a normal conversation, so that's good to see. And then inspecting your ears. Could you just put your hair back for me just so I can see your ears? Okay, they're positioned properly on both sides of your head. Sorry, do you mind if I...
Yeah, you're good.
Size is symmetrical on both sides. Skin is intact. I'm not seeing any lumps or lesions anywhere. There's no swelling. And then I'm gonna go ahead and check your external auditory meatus on both sides. Not seeing any discharge in here either. Moving to the other side, no discharge in there. I'm gonna move in onto your nose now. Looking at your nose, the features are symmetrical. It's positioned center on the midline. Do you mind if I'm gonna palpate or touch your nose? It's moist, and I'm not seeing any discharge, no cracking anywhere. And then so now I'm gonna move on to your mouth. I'm gonna go ahead and perform hand hygiene, and I'm gonna don clean gloves. So first I'm looking at your lips. Your lips are pink, they're moist, there's no cracking anywhere. And the features of your lips look symmetrical. And then I have a tongue depressor with me, and I'm gonna go ahead and depress your bottom lip because I'm gonna look at your teeth and gums, okay? Okay, you ready?
Yeah.
Perfect, your teeth are white, straight, evenly spaced, and free of debris. Gums are pink, no swelling anywhere, no abnormal lumps. And then, so now we're gonna move on to looking at your tongue. So first, could you stick your tongue out? Just like that, perfect. And I'm just gonna shine my light. Looking at it, it's pink, rough, symmetrical. And then, could you just stick your head up for me a little bit just so I can see? There's a thin white layer in the back, but that's okay, that's expected. And then could you touch the tip of your tongue to the roof of your mouth? Perfect, okay, smooth, pink, and there's veins present, and that's normal, that's expected. And then I'm gonna go ahead and check your buccal mucosa. So if you can open your mouth, I'm gonna stick this in you here. Smooth, pink, and glistening. And I'm gonna check the other side. Smooth, pink, and glistening, perfect. And then could you stick your tongue out and say ah? Nice big ah.
Okay.
Perfect. Your palate and your uvula both elevated when you said ah. That's what we like to see. It's the expected reaction. And then could you just open your mouth again and say ah? Because I'm going to check your tonsils. Nice big ah. There you go. There you go. Tonsils are oval and regular. Oval, rounded, not abnormally large. Looks like rough texture, but there's no discharge. And and there's also during that assessment there was no pressure, no odor present, and so that's it for the mouth assessment of the mouth portion of the assessment. I'm going to go ahead and throw away my tongue depressor and my clean gloves, and I'm going to perform hand hygiene again. And the last part is we're just going to check your neck. So looking at your neck. So it's centered on the midline. Your accessory muscles are symmetrical. I'm not seeing any protrusions anywhere, no weird lumps. Checking the skin, it's nice and soft, and not feeling any lumps either, none visible, none felt. And then so lastly, we're gonna estimate the range of motion of your neck. So first, could you just tilt your head forward with me and do it at the same time? Just like that. Then back up again. Could you extend your head back? Perfect. And then could you turn your head to your right side? Perfect. And then turn your head to your left side. And then could you touch your left ear to your left shoulder without raising your shoulder? Very nice. And then same with the other side. Perfect. And then the last part is I'm going to put my hands on your shoulders, and you're just going to try and shrug, and I'm just going to try and resist your movement, okay? There you go. Nice, strong, shrugging movement. And Miss Moyer, that is the end of my exam.
All right.
Thank you very much for your time. I'm going to go ahead and document this. I'll be back in about 10 to 15 minutes just to check on you. Do you need anything while I'm here, or do you have any questions?
No, I'm okay.
Perfect. All right. Well, your call light is within reach. And once again, thank you, Ms. Moore, for letting me care for you. And I'll be back in just about 10 to 15 minutes, okay?
Okay.
Thank you. And I'm performing hand hygiene on the way out.